All right, so I'm here with Deb today, and Deb has been under care for about 10 weeks. And Deb, why don't you tell us a little bit about, kind of why you came to our practice and kind of just the health problems and things that you were struggling with.
Well, about 20 years ago, I got sick with stomach and abdominal problems, and for 20 years they've said I had irritable bowel syndrome. So I've struggled with that on and off with different flare-ups. And then last May, I started this process of getting really sick, and I was sick all through the summer, on and off. I couldn't get well, and I was literally on a vacation, sitting in my hotel room for 4 days, couldn't leave the room while my family was having fun. So I'm a technology freak, and I started Googling Naperville, irritable bowel syndrome, and all of a sudden your web came up, your website. So I started reading, and I was interested in what I was reading, and was looking for a different approach. I was tired of going to GI doctors. And within probably a day, you sent me a bunch of information via email to read. So I mulled over that for a while and was quite interested in trying to find a different approach.
What kind of particular symptoms were you having? Tell us a little bit about the kind of symptoms that you were having, you were experiencing.
Well, the odd thing was I was vomiting a lot, which I'd never had have that happen before. Initially, I thought I had the stomach flu. Then about 2 weeks later, it happened again, and I thought I had food poisoning. So I really wasn't sure about that part of it. But primarily just I have gastrointestinal symptoms. I would have diarrhea on and off, all day in and out of the bathroom, and of course terrible abdominal pain. So lots of diarrhea, and then the vomiting part kind of scared me.
How long had you been suffering with a lot of these IBS symptoms, all these digestive imbalances and disturbances? How long were you really kind of going through that whole battle?
Well, like I said, seriously, 20 years ago when I was 37 years old, I started having my first abdominal pain and went in and had the typical test done and was told that I had irritable bowel syndrome. And over the years, I'd have some flare-ups. I'd be in the ER once in a while because I was in so much pain. And then I'd get better, and that would come back. But I'd never experienced how bad the past year was starting last May. So it's been a long time, but I usually could deal with it most of the time.
Yeah. So tell us, what's improved since you've been under care? You've been under care, like I said, now 10 weeks. And we actually just had our 10-week follow-up just a few moments ago when you and I were talking, and there were just a whole lot of things that had changed and improved. And why don't you go ahead and share some of those things with some of the people that might be watching this video?
Well, I'm a teacher, and in August I wasn't sure I was even going to be able to go back to work. The abdominal pains were so bad, especially on the right side, and the fact I'd be running in and out of the bathroom. I was really concerned that, am I going to be able to go back to school again? I might have to retire.
Wow.
And I was pretty beat up, pretty down with it all, and I'm a pretty tough cookie. I can fight through a lot of pain.
Yeah.
So the pain has subsided significantly. As I said today, on a scale of 1 to 10, I'd probably give myself an 8 or a 9. Many days I'm not in any pain at all.
That's great. And how often were you experiencing pain, though?
Oh, it was nonstop. Except if I fell asleep, and for a while it'd be subside, but it would wake me up too. So
sure.
I had hit a real low point in August. My friends at work were like, wow, you look terrible. Are you going to be able to work every day? And I said, I didn't know. I told them I didn't know.